In this week's lecture, we're going to be looking at weight management specifically related to diet, exercise, and behavior modification. A couple of things I'd like to point out as we get started in this piece of the lecture. One is that this is just a brief overview. There's definitely lots of specific pieces related to diet and exercise in particular, different ways to approach things. I'm going to cover some basic concepts, and then another area in this class that we'll really be looking at this is as you analyze a specific weight loss program and share those with the class and talk about the strengths and limitations of those different programs, we'll really keep some of these concepts in mind and add to them. But you'll really want to consider some of the concepts in this week's lecture as you review the various programs. The other thing that I want to point out is that diet, exercise, and behavior modification are really the cornerstone to weight management, regardless of whether that's the only piece that you use or whether someone also uses, for example, medication or surgery or something to help start the weight loss. These principles that we're going to be talking about this week really apply to weight loss regardless. So hopefully that gives you a little bit of an introduction as we look at diet, exercise, and behavior modification, really from the perspective of if this is what you're doing without, for example, medication or surgery. So we will switch to the PowerPoint and go through a few things with diet, exercise, and behavior modification. Okay, so just kind of an overview. When I talk about diet, I'm talking about someone's food intake. It doesn't necessarily mean what we think of as a quote unquote diet, although it might be in this case, but just their food intake. When I talk about exercise, some people prefer to refer to that as physical activity or movement. Any of those terms are okay. Sometimes exercise can have a negative connotation with it, and people feel like kind of that feels like drudgery. So sometimes different terms are preferred. And then behavior modification, we'll talk about exactly what that entails as we go through this lecture. So when we think about weight loss goals from diet, exercise, and behavior modification, there's different ways to look at goals. In general, if we are thinking about weight loss from a health improvement perspective, generally losing about 10% of body weight can show improvements in health status in things related to diabetes, high blood pressure, cardiovascular risk, those types of health factors that we typically associate with excess body weight. And I point this out because it's important for individuals to realize that they don't have to get to what some chart would say is an ideal body weight in order to have health benefits from it and probably to really feel better. That 10% is a ballpark. You'll see some things say as low as 5, some things say 15%, but in general about a 10% weight loss pretty consistently shows improvement in health parameters for people who have those health issues. In terms of weight loss goals, often 2 pounds per week is what you'll hear. So that's kind of a maximum. Anywhere from a half a pound a week to 2 pounds a week is really a very good goal when someone is modifying their diet and exercising. Now you might be thinking, a half a pound a week, are you kidding me? That's like nothing. But because if they're making small changes, those are likely to be sustainable changes, which is excellent, but it's going to go more slowly with the weight loss. So having a little bit more slow, gradual weight loss is going to help them be able to sustain that weight loss. And really, if they get beyond about 2 pounds a week, often it's more difficult to sustain that. Losing more slowly helps people lose more fat mass as opposed to losing more of their lean body mass, and so that's helpful. Now, the reality is if someone has a lot of weight to lose, initially they may be losing more than 2 pounds a week. Some of that is a fluid loss that goes with that initial weight loss, so I'm not panicked if someone loses more than 2 pounds a week initially, but just realizing for the long term, that's anywhere from a half to 2 pounds a week is a good goal. I also try to help patients remember that we're looking long term. So if you think a half to 2 pounds a week over the course of 6 months or a year, that's a lot of weight. And yes, it's going to take a while to get there, but that's the most likely way to be able to sustain that weight loss. So just kind of some things to be realistic about the weight loss goals that people are setting for themselves or that we're helping them set. So the first of kind of the 3 arms that I'm looking at today, the first is diet or food intake. So something to keep in mind, you've certainly looked at this basic nutrition information from other coursework. So I'm not going to go back over it in tons of detail other than to help you remember that how this all relates to weight management. So one thing, calories really do matter. We don't have an exact number for sure, exactly this many calories to lose weight, or exactly this many calories is how many you'll be eating if you do this, or it's not totally precise, but really calories do matter. And remember that in terms of calories, we only have three nutrients that give us calories. So that's fat, carbohydrate. Let's see, try and get my little drawing tool here. Okay, fat, carbohydrate, and protein are our three nutrients that give us calories. And then I did remember to put alcohol in there. That does have calories. We don't consider it a nutrient because it doesn't give our body something that we need to have to be healthy and sustain life, contrary to what some might believe. No, I'm just kidding. But so fat, carbohydrate, and protein are three primary sources of calories. And so I put this in this circle here because we have to remember, if we are staying in the same calorie level and we decrease one, the other is going to go up. So for example, if we try and have a low fat diet, so we kind of try and shift this arrow this way a little bit and make fat the smaller piece of our pie, either protein or carbohydrate has to increase. So if it's carbohydrate, then all of a sudden our carbohydrate might be this larger piece of the pie, so a larger percent of our calories. Or it could be protein, and hopefully we're not making up for the calories with alcohol, but that is an option as well. So why I point this out is because when we talk about macronutrient balance, so remember, macronutrients are carbohydrate, protein, and fat, as opposed to micronutrients, which are vitamins and minerals. If we go low carb, either fat or protein needs to increase percentage-wise. So if we're looking at percent of calories, if we go low fat, either carbohydrate or protein increases. So I think it's important as you're analyzing diets or thinking about a particular macronutrient distribution, what's the trade-off? So if you go lower in one, where are you going to replace those calories from a percentage perspective? So if we say we need to reduce calories and that calories really do count, I feel like the trick then is, how can we reduce those calories without feeling like we're starving to death? Because that's really, if people feel overly hungry, that tends to be when they're going to not make as good of food choices, not do what they really intended to do because they're feeling really hungry. That's our body's totally normal response. So I want you to remember something we talked about earlier in the course, are some of those factors that affect satiety. Remember, satiety is that feeling full. So remember, we have stretch receptors in our stomach. So when those stretch a little bit, that helps us feel full. So if we can have foods that give us some bulk without a lot of calories, that can help with fullness. And that's where some diets kind of base their principle. Think about raw vegetables, for example. How bulky are those? They don't have a lot of calories, but they give you that bulk that can help with satiety. The type of nutrients. So some nutrients, for example, protein, tends to be more satiating or filling than a simple carbohydrate. A complex carbohydrate, so something with a lot of fiber that's not really refined, is going to be more filling than a processed carbohydrate. For example, white bread or that sort of thing. Our blood glucose levels can affect our hunger and fullness levels. So when our blood glucose level drops, if it's been a long stretch of time since we've eaten, we feel more hungry. So if we can try to keep that blood glucose a little bit steady throughout the day, that can help. And then there's psychological factors that I mentioned earlier in the course as well. So this is where I think, again, we sometimes forget this piece, but it's important that if someone is trying to cut back their calories a little bit, when they do eat, that they enjoy that eating, that they sit down and really think about what they're eating to help not only their body feel full, but their mind sort of realize that they've had enough to eat, and that they feel satisfied with what they've eaten. So a few things, again, these are things that you've really had before, I'm assuming in other coursework, but just to kind of refresh you and help you think about these again. Some meal planning tools and strategies. So all of these things listed on the screen, people can count calories. They can adjust portion sizes. So just saying, okay, I'm going to eat, a quarter less of what I usually eat. So if I usually eat 1 cup, I'm going to eat 3/4 of a cup, or whatever. Just adjusting those to help with the calories. The plate method listed is kind of that idea that you have possibly heard before, but thinking what's on your plate and trying to fill half of your plate with vegetables, a quarter of your plate with a protein, a quarter of your plate with some sort of starch, and then perhaps milk and fruit on the side if you choose. Kind of the idea of just shifting the proportions of food you're eating. Increasing or decreasing specific food types, and this is a common strategy for weight loss diets. I actually really like thinking about what we can increase, because it's a lot more fun to increase foods and it feels a lot better than try to always think about what I'm decreasing. So for example, if we could help someone increase their intake of fruits and vegetables, often what that does is those fruits and vegetables start to replace some of the higher calorie snack foods, perhaps like chips or maybe crackers or things like that aren't bad necessarily, but it's just easy to get a lot of calories. The macronutrient distribution, we talked about that a little bit. So looking at, okay, do I need to increase my protein intake a little bit? Do I need to increase my fat intake a little bit as a percentage of total calories? In frequency of eating, generally my rule of thumb is I encourage people to try to have something to eat about every 4 to 5 hours. You don't have to be constantly grazing throughout the day, and actually I really discourage that. But having something to eat about every 4 to 5 hours generally helps people feel comfortably full, and it doesn't let them get so hungry that they make food choices that they really hadn't intended to make. Again, that kind of goes with timing of eating, spacing meals throughout the day. Planning ahead is key, so that you have the foods available that you're going to be able to make the meals and snacks that you intended. And then label reading, again, something you've learned before, but all of these are tools that you can use to help patients or clients with their weight loss goals and really to help them achieve that reduction in calories that they're trying to achieve to lose weight. One thing I wanted to mention briefly, we won't go into a lot of detail, are very low calorie diets. And I'm mentioning these because these are a specific type of diet that are very, very low calorie, as the name implies, less than 800 calories a day. They require vitamin and mineral supplementation because it really is not feasible to get all the nutrients you need from food when you're eating that few of calories. And it really should be done under the supervision of a medical healthcare provider, because with that rapid weight loss, there are some risks that go along with that. So I'm not going to go into a lot of detail, but just something to consider if people are looking at these very low calorie diets, that there are some risks and they really should be done with medical supervision. So that's kind of a quick overview of the sort of diet, food portion of some things to think about with weight loss, and your readings this week have considerations with that as well. And in the next segment, I'll talk a little bit about some of the concepts associated with exercise for weight loss.